A second Ebola treatment center is set ablaze in eastern Congo, with 18 suspected cases fleeing. Add AP News as your preferred source to see more of our stories on Google. Add AP News on Google. Add AP News as your preferred source to see more of our stories on Google. Share BUNIA, Congo AP. Angry residents of a town at the epicenter of the Ebola outbreak in eastern Congo attacked and burned a tent that was part of a health center where people are being treated for the virus, the staff there said Saturday. It was the second such attack in the region in a week. No one was hurt in the attack, according to initial reports, but as patients ran out to escape the fire, 18 people with suspected Ebola infections left the facility and are now unaccounted for, a local hospital director said. The angry residents had arrived at the clinic in the town of Mongbwalu on Friday night and set fire to a tent set up for suspected and confirmed Ebola cases by the Doctors Without Borders humanitarian group. Dr. Richard Lokudi, director of the Mongbwalu Hospital, told the Associated Press, "We strongly condemn this act, as it caused panic among the staff and also resulted in the escape of 18 suspected cases into the community," he said. On Thursday, another treatment center in the town of Rumpara was burned down after family members were banned from retrieving the body of a local man suspected to have died of Ebola. The bodies of those who died of Ebola can be highly contagious and lead to further spread when people prepare them for burial and gather for funerals. The dangerous work of burying suspected victims is being managed wherever possible by authorities, which can be met by protests from families and friends. Read more. A communal burial for Ebola patients in Rumpara took place on Saturday under tight security as tensions between health workers and the local community ran high, said David Basimer, a team leader with the Red Cross overseeing burials. Armed soldiers and police monitored the burials as Red Cross workers clad in white protective suits lowered sealed coffins into the ground. Crying family members stood at a distance. Motorcycle taxi riders and their passengers wait at the entrance to the central market, while sanitation workers disinfect the area as Ituri province continues to combat an Ebola outbreak in BUNIA, Congo, Saturday, May 23, 2026. AP photo/Moses Sawasarwa motorcycle taxi riders and their passengers wait at the entrance to the central market, while sanitation workers disinfect the area as Ituri province continues to combat an Ebola outbreak in BUNIA, Congo, Saturday, May 23, 2026. AP photo/Moses Sawasarwa. Add AP News on Google. Add AP News as your preferred source to see more of our stories on Google. Share Facebook, copy link, copied print, email, X, LinkedIn, Blue Sky, Flipboard, Pinterest, Reddit. Read more. Basimer said his team, after arriving at the scene, experienced a lot of difficulties, including resistance from young people and the community. "We were forced to alert the authorities so that they could come to our aid, just for safety," said Basimer. Authorities in northeastern Congo on Friday banned funeral wakes and gatherings of more than 50 people in an effort to curb the spread of the virus. The World Health Organization has said that the outbreak now poses a very high risk for Congo, up from a previous categorization of high, but that the risk of the disease spreading globally remains low. WHO Director General Tedros Adhanom Ghebreyesus said on Friday that 82 cases and 7 deaths have been confirmed in Congo, but that the outbreak is believed to be much larger. There is no available vaccine for the Bundibugyo virus, a rare type of Ebola, which spread undetected for weeks in Congo's Ituri province following the first known death, while authorities tested for another, more common, Ebola virus and came up negative. There are now 750 suspected cases and 177 suspected deaths, though more are expected as surveillance expands. Dr. Jean Kaser, Director General of the Africa Centers for Disease Control and Prevention, said a response to the outbreak must include building trust with communities. The International Federation of Red Cross and Red Crescent Societies said on Saturday that 3 of its volunteers had died from the outbreak in Mongbwalu. The agency said it believed the 3 healthcare workers contracted the virus on March 27 while handling dead bodies as part of a humanitarian mission unrelated to Ebola. If confirmed, this would significantly push back the timeline of the outbreak from the previous first confirmed death in late April in the town of BUNIA, the capital of Ituri. United States federal health officials said Friday night that they are banning green card holders who have been in Ebola-affected countries from returning to the U.S. Green card holders are people who are not U.S. citizens but have been granted authorization to live and work permanently in the United States. According to a Federal Register notice on Friday, the U.S. government is enacting a rule that restricts green card holders who have recently been in Congo, Uganda, or South Sudan from re-entering the United States. The rationale: such a ban will help ensure that Ebola screening, contact tracing, quarantine monitoring, and medical monitoring will be available to U.S. citizens, according to the notice. Federal law provides for a comment period before such rules become final. But, in the notice, an HHS official argued they are allowed to order it to take effect immediately in certain circumstances. HHS officials did not immediately respond to a request for comment. McMakin reported from Dakar, Senegal, and Mike Staub contributed from Washington, D.C.